you were our first patient.
Really?
You were our first patient, yeah. And when did we do your surgery?
Oh, I don't know. What, did it start 5 years ago?
Almost. Took a couple of years
It has to
ago.
be 5 years ago.
So I want to know a few things because this is for
Yes.
other patients that want to have this.
Absolutely.
So what made you want to have the surgery?
I couldn't eat. I didn't feel good about myself. It was a terrible, terrible thing to have bad teeth. It's an awful thing.
And from a financial point of view, I know you're not a person of great wealth.
No.
So how did you in your head say, okay, I'm going to get all this money together? What kind of brought you to the point of saying, I want to spend this money?
It's something that I've wanted to do for years. So you save, and then you think, you know what, I'll get a loan and I will just do this and work till I pay it off.
So did you get a loan?
Yes, I did.
Wow.
Yeah.
And I remember something changed for you at work. Like after
Yes, well, I was in housekeeping, cleaning toilets. That's how hard I was working to pay this money off. And then I had an opportunity, once my teeth were done, I had an opportunity to apply for a job in the cafeteria of the hospital. And I thought, I'm going for it. And I got it, and it's great. But having felt better about myself and appearance and what have you, made a hell of a difference.
So tell me how you felt when you found out the implant. So implant number 25 failed after 3 years or so.
Right,
I'd say.
right.
How did you feel when you said, "Oh my God, this implant's failed"? What was your thinking?
Very disappointed. I was afraid that possibly I wouldn't be able to have them, that I would have to go with a denture.
Regular denture.
Yeah.
So you were actually disappointed. You thought maybe.
Oh, yeah.
Did you think it was your fault? Did you think
Yes.
you did something wrong?
Yes.
What did you think you did wrong?
Well, I thought maybe I was grinding my teeth too much, and I do a lot of physical things at work too, so I thought, well, maybe I've done something too strenuous.
Right. And so when you saw me and you realized we had to redo things,
Right.
what were your thoughts in that?
I thought, I can't afford this. I thought you would be charging me again or more. I'm not going to live long enough to pay this all off. Yeah, I was really, really impressed the way yeah, 25 pounds.
You need hard stuff, like you can have a steak.
Oh, apples.
Apples. I can't even eat apples.
Well, see, yeah, I mean apples, corn on the cob,
Anything.
steak, whatever it is that you really want.
When you eat something, how does it feel? Does it feel like you got, like it's a different feeling than teeth?
You get used to it, but it's a very firm, it's a very enjoyable because they're not moving,
Yeah.
right? It's not like a denture where you think, ooh, when you bite down and take it away, am I going to have a problem? No.
You have full confidence when you go and bite into something. You just
Absolutely.
full confidence into
Yeah.
whatever you're eating.
Yeah.
What do you find
And I
about?
eat salads and carrots and things
Can
like
you
that.
eat the little stuff, the little tiny like?
Yes, I of course I love anything with the seeds in it, which there's the gap. But saying that, the water pick, you can't be without that.
You find.
You do retain a lot of small things again. Food gets in there.
Upper more than lower?
Upper more than lower.
Yeah.
Yeah.
What about so your hygiene maintenance? So are you doing this like you're brushing and cleaning like 2 or 3 times a day?
Yeah.
Do you bring your stuff when you go to a restaurant? Do you have to?
I do. I have a portable water pick.
A portable water pick.
Yeah.
It's got its own little water supply.
Oh yeah. Oh yeah. Oh yeah. Nothing. When you get to this point, nothing's too much trouble, right? Or cost. No, if it's out there, I'm having that because it goes in the bag. You go into the washroom, fill the little reservoir on the portable water pick. I'll be right back. You do your swish about, come back out, enjoy your wine. Yeah.
What did your husband think about all this?
Now there's the man that should actually have the medal, and he's been amazing. Absolutely amazing.
Through the whole thing.
He has.
Did he not say to you, "Oh my God"?
He's been sitting in that friggin' waiting room, driving me back and forth.
Oh, yeah.
Nothing is too much trouble.
When you were about to spend this money, what did he say?
Absolutely.
Go for it.
Yeah.
That's amazing.
It is amazing. Now that probably doesn't happen a whole lot. You know what I'm saying? I mean, there's lots of women.
Yeah.
One lady that called me one time, she was selling an old car that was in the driveway that had been sitting there for 20 years. He was collecting cars, right? She said, I'm selling the car. I'm going to have a 55 Buick in my mouth. Go for it. Good for you.
Better than have it in your mouth than in the driveway, right?
In the driveway, yeah. I think anesthetic, like, that was scary. Like, am I going to wait? Is it going to be, and pain.
Right.
Am I
You
going
were
to
worried
be
about pain after.
a lot of pain, which I must say, amazingly enough, it was not bad.
When you came in, like when you're sitting in the chair,
Yeah.
just about before
Yeah.
you're about
Yeah.
to go to sleep. Well, what's going on in your head?
Well, you just think you've waited all your life for this.
Really?
You think this is the moment, right?
Right.
I mean, it's a huge, because my teeth were so bad. I mean, there was an overbite, there were gaps, there were no teeth at the back. I mean, it was going to be a life-changing, you're going to have a mouthful of teeth, which is pretty bizarre. But I recommend it. And I work in a hospital, and I've had a lot of people come up and go, wow, where do you go for them? So your name's out there.